say that on our website, there's 28 special COVID reports, which we were sending to the government at the time we were publishing them from our helpline data and what hundreds of care staff were telling us was happening. The government knew we were submitting this evidence to the government at the time. I don't think this report is damning at all. I think it's pretty much a lukewarm whitewash to try and distract from the real issues. And also, I take umbrance with saying that the public inquiry will hold people to account, because the public inquiry is already saying it's not going to hold people to account. So that's misleading the public. So that's totally wrong. If you look at our evidence and what care staff were telling us in their hundreds of whistleblowers, which whistleblowing is very lightly touched upon in that report, which is at the heart of the issue and why we campaign for Edna's Law. But if you look at what care staff were telling us, staff that were crying because they were frightened to go to work, that were using sanitary towels as face masks and bin bags as PPE. You know, that we're watching people, it's not mentioned at all in this report, and our FOI to the regulator exposed that most of the people that were calling us were from residential care homes, that people were dying in agony with no medical intervention whatsoever. We asked Boris Johnson, would he be happy to have gone into a care home where there was no medical staff when he had COVID and to suffer with no intervention at all? And this is a tragedy beyond words. Our helpline took a 60% increase in calls. We've never seen anything like this, and we are always busy. But whistleblowers, they actually lost their jobs for saying this is wrong. And yet we have a care industry that, you know, these big companies, it included some of these big companies where care staff had no PPE and they've got massive offshore profits. And none of that is in this report. None of that has been dealt with. The question is always, how much do social care providers want us to give them? Ask care staff what they need. And they won't be looking at profits. They'll tell you what they need. And they're the people that are not being listened to. So I am quite appalled at this report and at the language of moving forward, learning lessons. This is political spin for covering up an atrocity. This government didn't just make a mistake. Initially, it's care home policy, placing COVID patients into care homes, that you could say that was a mistake. But when it was pointed out and they knew how many people were dying and they continued with that same policy, that isn't a mistake at all. That's basically genocide. And it's not too strong a word, because they knew what was happening and they continued with the same policy. And we're still dealing with, in the last 2 weeks, designated care homes where people are being placed in homes that are not even compliant with the regulations. So it continues. The mistakes of today continuing. It's not something that there's a cut-off time to.